everyone, and welcome to another episode of the Veterinary Business Podcast, where we explore the ideas, innovations, and strategies shaping the future of veterinary practice. I'm Dr. Amanda Landis Hannah, and I'm thrilled to be your host today. Our topic for this episode is one that connects the art of medicine with the realities of running a business. The title today is Guarding the Pharmacy: Compounding's Impact on the Business of Veterinary Health. Compounding allows veterinarians to deliver personalized, patient-specific treatments, helping overcome issues like dosage limitations, availability challenges, and compliance barriers. But beyond the clinical benefits, compounding also plays a powerful role in client trust, operational efficiency, and overall practice performance. To help us explore how personalization and compliance intersect with business success, we are joined again by Dr. Rae Hutchins, Chief Veterinary Officer at Wedgewood Pharmacy. Dr. Rae Hutchins is a board-certified small animal internist and accomplished veterinary leader with extensive experience in clinical medicine, multi-site operations, and organizational strategy. At Wedgewood Pharmacy, she leads the clinical strategy and innovation, helping veterinary teams deliver exceptional, sustained patient care through access, efficiency, and customized solutions. Her leadership background includes roles at United Veterinary Care, VCA Animal Hospitals, and Pet Partners, LLC, and she continues to mentor the next generation of veterinarians as an adjunct faculty member at North Carolina State University College of Veterinary Medicine. Dr. Hutchins, it's always a pleasure to have you on the podcast. Thank you for joining us again to discuss how compounding is not just transforming patient care, but also strengthening the business of veterinary health. Before we get started, as a thank you for tuning in, we are offering all of our listeners complimentary veterinary practice marketing strategy meetings exclusively for our podcast audience. It's a short, personalized session designed to help you uncover opportunities and enhance your practice's visibility. You can claim your session at veterinarybusinessinstitute.com/MSM. Rae, let's dive into today's discussion. I'm so excited to be speaking with you again. But for those of our listeners that weren't able to join us previously, which I do recommend, obviously, that everybody goes and listens to our previous session, give us a little bit about yourself. How did you go from internal medicine and get to being in this very, very prestigious role with Wedgewood Pharmacy? What do you love every day about your job?
Thank you, Amanda. Thank you for having me, and thank you to the listeners that are tuning in. This is a great topic, so I'm really looking forward to this discussion. Gosh, what do I love about what I'm doing every day? What I love about what I'm doing every day in this role is that I get to be a part of helping to solve problems in care and bringing the value around how we solve those problems to the practice and working alongside practitioners and growing their practice in the way that they want to. So being close to a lot of the business pieces of the practice and being able to tie that so closely to incredible medicine and the passion that our veterinary profession has around delivering that medicine, that fills my cup, that fills me with joy every day.
That's awesome. I completely agree with you. We are, by our very nature, people in the veterinary industry are problem solvers, right? We picked the most difficult patients to work with.
That's right.
So we have to be problem solvers. But I love that you have positioned yourself in the veterinary industry to support veterinarians and their clients and their patients, allowing you to have such great impact. I imagine that's got to feel very energizing as well.
It is. It is. I loved practicing internal medicine. I still love talking about internal medicine. And I think that part of why I loved internal medicine was because it was so complex and I never quite knew what path we were going to go down. It was like I was solving a mystery or putting together a really complex puzzle. And putting together that complex puzzle with people that are as passionate about animals as I am is a really joyful place to be.
Absolutely. I feel the same way about developing technology for veterinary medicine, veterinary patients. No matter what the species is, right? You want those challenges and you want to create the best opportunities.
Yes.
Well, speaking of opportunities, let's talk about the power of personalization. Compounding pharmacies really allow veterinarians to personalize care in ways that some commercial products cannot do. How do you see customized formulations improving patient outcomes and compliance, especially in complex or exotic cases or exotic patients?
We know that compounded preparations bring an advantage in that they can be modified to help assist how medication is given. So it's really important to highlight a piece of what you stated, which is some commercially available medications don't check all of the boxes of what we are trying to accomplish as veterinarians and veterinary professionals. And when that is the case, compounded preparations are a great option to help you do that. So to me, the way that I think about compounded preparations in practice is I know that in modern veterinary practice today, clients are expecting that personal touch. They're looking for a reason to be loyal. And a big part of why clients want to be loyal is because they feel as though you've connected to them as a client and to their pet. You're not just seeing their cat with hyperthyroidism, you're seeing their specific pet who has a disease that they're grappling with, and you know a little bit about their family dynamic, and you're helping them bridge that barrier to care. And compounded preparations provide an opportunity for you to personalize the treatment to that client and to that patient proactively so that they believe, because you are, that you are finding a path forward to help them that's unique to them, their situation, their pet, their family.
That has such a huge impact on the human animal bond, which our listeners know that I'm incredibly passionate about and I lecture on. I imagine that there is a lot of positivity in the patient client veterinary relationship, the VCPR, by having more opportunities available. Do you get that? Do you hear about that at all?
All the time. So a lot of time, what we hear from veterinary professionals is we love compounded medications because I had a really big challenge with a patient, and that compounded preparation solved that challenge and gave me confidence that the patient was getting what they needed and that the outcome was going to be better than if I was trying something that required stress on the human animal bond or that relationship. Or we'll hear it kept that client coming back because they felt as though we listened to them and we had a solution for them that was differentiated and helped them achieve their goals with their family pet. And so we hear that a lot. And it's everything from it was easier to give that medication from a standpoint of physically giving that medication to the pet, all the way to it helped with the logistics of care. And I think that that is what I love about compounding is it's breaking through those barriers in many different ways. And because it can do that in many different ways, it can be a tool in your practice building toolbox.
Wonderful. In that toolbox, though, we have to navigate regulation while we're doing some of this innovation. You know, the FDA has really cinched down. And while it is in the interest of providing additional safety to humans and animals, it can become somewhat constricting, I would imagine, for compounding pharmacies like Wedgewood. So how is Wedgewood advancing personalized veterinary formulations while staying within those federal and state guidelines? What should veterinarians know about patient-specific prescriptions and selecting pharmacies that follow the updated USP standards to ensure safety and actual drug delivery?
It's an incredibly important question that any veterinary practice should be asking of their compounding pharmacy. Compounding is a highly regulated space. It's regulated both by the FDA and by the state boards of pharmacy. And any compounding pharmacy that is providing compounded preparations within a state, they should be very current with those regulations and guidelines and making sure that they are distributing medications to the prescribers or to the patients in a way that is in alignment with the federal guidelines for industry, as well as the State Board of Pharmacy regulations. So first and foremost, when you choose a compounding pharmacy, it's really important to validate that they take that seriously and ask, how are they doing that? Where that has implications for the veterinary practice, really truthfully, is how you navigate options for office stock, which is a really common way for veterinary practices to have compounded medications, and patient-specific medications. Office stock generally means that you have a compounded preparation that you can dispense directly from your office to many patients, whereas patient-specific means that you are writing a specific prescription that the pharmacy is filling for that patient. One of the ways that can be navigated is by looking at a 503B pharmacy as opposed to a 503A pharmacy.
Oh, goodness. You're going to have to explain. You're going to have to explain those.
Yes. And let me step back. I said 503B pharmacy, and what I really meant to say is a 503B facility. That is a facility where compounded preparations are made at larger scale because the compounded preparation that is being made serves a higher volume of patients, meaning more patients need that specific type of compounded preparation. And so it can be made at larger scale because it is made under the good manufacturing practices that are required by the FDA. It can be distributed to a veterinary practice, and the veterinary practice can then distribute that to patients. A 503A pharmacy, and alternatively, is specifically a more custom-focused pharmacy. So that is a pharmacy that can take a very customized or very personalized prescription, ideally has a team of pharmacists that can determine that that prescription that has been entered actually will provide the medication in the way that's intended and in a safe way. And then they make that prescription specifically for that patient, and they are able to send it to that patient. So those are two very different setups, as you can see, but both of those should be done in the same high level quality, meaning that the thought and expertise of pharmacists and the quality standards that are required by FDA and by USP and state boards of pharmacy, those should all be taken into account in the processes and procedures in the 503B facility and in the 503A pharmacy.
Okay. Yeah. So I understand and recently caught wind of a Brachy study with Wedgewood examining the role of online pharmacies and home delivery in veterinary practice. What came out of that research about our clients' purchasing behavior and how that impacts practice performance? What are some of the key learnings from the study that you could apply to compounding or veterinary medicine at large?
I'm so glad that you caught wind of that, because that was a really big effort that Brachy and Wedgewood did together. So Brachy essentially surveyed over 1,000 pet owners and over 350 veterinary clinics, and with the sole purpose of understanding what are the buying habits like in this patient-specific world of prescription management, and how can you as a practice really learn from this experience and these trends to make sure that you're setting your practice up for success. If you have interest, if the audience has interest in this information in more detail, Wedgewood did do a 3-part CE series that's available virtually, and co-hosted that with the Brachy team who did this research. And it was a fascinating study, because while it did not share information that to me was dramatically surprising, it emphasized some key points that I think we as a veterinary profession just must pay attention to in this modern world of veterinary medicine, especially when patient-specific prescribing and personalized care is being sought after with our clients. So some of the key findings that they identified in that study is that around 62% of millennials and Gen Z are more likely to buy medications online. That's not surprising. In fact, if anything, I would think that number would be a little higher. But what was surprising is that almost 50% of older generations are also shopping online too. And so the key point that I found fascinating in that is, while millennials or Gen Z may have started this movement, it's pretty much all encompassing. Everyone is going down this road or this path of online pharmacy and e-commerce purchasing. What was also really interesting to me is that over 85% of those people that participated in the survey, they want to trust their veterinarian, but less than half of them even knew their veterinarian had an online platform. So I found that very interesting as well, because you already, as a veterinary professional, you have the trust of your clients.
Right.
And there's some very key things you can do to really help that trust be a foundation for delivering great care to your patients. And helping to build awareness of an online pharmacy. I mean, think about it. If less than half of them even know that you have an online pharmacy, that's an opportunity. So if less than half of them know that, this is where I think compounding medications can actually help you build your control of your prescription management.
Okay.
If you utilize compounding to say, hey, I know that this medication is going to be really challenging to give to your pet because of your work schedule. There is a compounded solution that will help with the schedule of how we give these medications, and that's available through my online pharmacy platform. You've just done 2 things. One, you've made it very clear to that client that you know them, you're personalizing your care to what they need. And then 2, you've made it really clear to them that you have an online pharmacy. And so you're automatically driving them to that platform through that personal connection. And once they're there, they're locked in. They don't want to go anywhere else. Furthermore, over 72% of the respondents of the survey said auto ship helps them with compliance. So if you start a compounded medication to ease the ability to achieve that compliance and you put them on auto ship, you're already in one fell swoop taking an action that increases dramatically the chance that your patient is going to get the care that they need.
Thank you for that reminder about auto ship, because it's this time of the month, every month, that I'm like, oh, I got to make sure I tweak my auto ships. So I can personally speak to the efficacy of having auto ship for everything from dog food to medication.
That's right.
You know, we are all human. We all need every bit of support we can get. So for veterinarians or practice managers looking to evaluate a compounding pharmacy, what are the most important indicators of quality? Where can listeners find resources or CE on compounding pharmacies sites to learn more? Is it, do they get a report card? Do I get an A+ report card from each of my compounding pharmacies?
It's a great question. I think that one thing I would recommend is that you go to your compounding pharmacy's website. A lot of times those websites will showcase where there is key information about products, education material about those products. That's really important. You need to know what you're prescribing, what's in those products, what's known about those products. Other important information is CE. I can speak for Wedgewood that a lot of the CE that we have provided to the profession is available on our website and also on our social media platforms. I think more and more companies are looking to the digital space to share that information. The other key thing that I would say is looking to the types of education that a compounding pharmacy is providing. There's a lot of opportunity to learn more about how to compound in a way that is compliant with regulations, how to weave that into your practice. Mm-hmm. And there are a lot of different approaches or ways to do that. And depending on what those topics look like and see, that's a great resource specific to some products or just how to manage your inventory or how to leverage compounding in particular. Mm-hmm. The other recommendation that I would share is call a compounding pharmacy and say, tell me about your protocols. Do you have adverse event quality reporting? Do you have regular audits with the FDA or your state boards of pharmacy? The answer to those questions should be yes. And that's a really easy question to ask and a really important question to ask. You as a prescriber, as a veterinary professional, you don't have to be an expert in compounding, but you should definitively partner with a pharmacy that is an expert in compounding pharmacy.
Are all compounding pharmacies equally trained in human compounding and animal compounding, or are there particular aspects that we need to be looking for our patients?
That's another really important thing to ask in your partnership. Not all pharmacists have veterinary specific education. And that is logical. If you think about it, pharmacy school is focused on pharmacy and pharmacy is focused on human medicine the majority of the time. Mm-hmm. However, in practice, a lot of pharmacists are seeing an increasing number of veterinary patients, and they are not required to have that veterinary specific training. So Wedgewood is a veterinary specific compounding pharmacy. That's an important piece to look into. And on top of that, we have pharmacists that have had veterinary specific training and have ongoing CE and veterinary specific platforms and learnings. Okay. And so my answer to your question is no, not all pharmacists are trained equally. And that is something that as a veterinary professional and as a prescriber, you should ask those questions. What is your background in veterinary specific pharmacy and compounding? And what are your best practices to make sure that you're staying current in that information?
Yeah, great point. Obviously, there have been horror stories of cases where some of that information did not get filtered in. Also, horror stories about medications getting amplified in magnitude and incorrect dosings occurring. So I think being able to trust who you're working with is absolutely vital, because the medication that you're sending home from a compounding pharmacy is a direct reflection on the veterinarian. The compounding pharmacy isn't going to lose the client, the veterinarian is.
It's a really, really important care. Like, as we look at the veterinary macroeconomics right now we know visits are declining. We know that in some practices, they're having fewer and fewer touch points with their clients and their patients.
Right.
So every piece of the care that you prescribe as a veterinarian that happens outside of your four walls and is an extension of the care that you provide.
Mm-hmm.
And so as we think about practice building and practice safeguarding, it's really critical to think through, how can I make sure that, one, I'm partnering with a pharmacy that supports and maintains my control as the prescriber over this prescription management,
Right.
and is delivering that prescription in a way that meets the quality that I expect as the prescriber or as the veterinary professional that is providing care to this patient.
Mm-hmm.
And when I talk about managing the prescription life cycle for a patient, when you prescribe a medication, especially if it's for a condition,
Right.
it is a very great opportunity to say, these are the expectations I have for response to therapy, and here are my recommendations for how we follow up. And if you have oversight of that prescription, you will have much more visibility into, was the medication given as I recommended it? And is there an opportunity for me to drive this patient back into the office so that I can see them, continue to build on that loyalty, and continue to make sure that we're having the outcome that we want in this condition and in this patient?
Yeah. So important. As we look more towards the economics, macroeconomics, as well as the social economics of veterinary medicine right now, what are the pieces that compounding can help bring to the table for hospitals' bottom lines, and how should practice leaders strategically think about it? Is it something that, say, someone corporate on high should be thinking about, or is it something that each individual practice can really consider the potential implications for that hospital's revenue, business strategy, keeping the lights on, keeping the whole team employed?
Yeah. To me, I like to really think through patient-specific prescribing when I think through this question that you're asking. And the reason I like that is because, really truthfully, it's the direction that the profession is going, based on regulations, based on the drivers of the expectations of clients in modern veterinary care. Patient-specific scripts is where it's at right now, which is a big transition from where veterinarians used to have the luxury of having office stock and dispensing and selling that office stock. Now, their clients are shifting more towards getting medications outside of the four walls of their practice. And that's for, one, personal preference and convenience, and two, honestly, regulatory plays a big role in that. So as I think through, how can veterinarians leverage compounding to combat some of the revenue or margin erosion that may come with that shifting landscape, it really truthfully is all around stickiness of a treatment that you are prescribing. And compounding has a tendency to be sticky. And the reason I say that is because, again, you can utilize it as an opportunity to connect with that client. Right. And identify clearly for them that you know who they are as a person, and you care about the outcome of this treatment and the experience that they have administering it. So that in and of itself is sticky, because you're driving that client loyalty to your practice and to you as a professional. Mm-hmm. Additionally, if you drive that compounded medication through an online pharmacy platform, they're going to stay there. So I referenced this earlier in the conversation that once they're on your platform for e-commerce or for purchasing prescriptions or medications, they're going to want to stay there. Once they have awareness of it, the trend from that Brachy study is that clients want to stay there. So as long as they know about it, the pricing is relatively similar, the service is relatively similar, they're going to shop for what they need within that platform. So then you're driving revenue back into your practice through that online pharmacy platform. And that extends well beyond compounding. So you can use that compounding as both a vehicle for client loyalty, but also a vehicle to get them to your online purchasing platform.
I think that that's great. Anything that we can do to, really heighten that engagement. And to your point, creating a relationship that is trustworthy and reliable will help to decrease attrition as well.
Absolutely. Absolutely. If a client believes that you're there for them and that you know them so well that you're able to personalize that treatment plan, that's a game changer. That becomes a way to tie them to your practice so that the next moment something happens with their pet, they're thinking of you first and not a third-party provider where they bought a medication.
Or Dr. Google.
Or Dr. Google.
Well, Rae, thank you so much for your time. We at Veterinary Business Podcast love speaking with well-educated, well-spoken partners in the veterinary industry. Thank you for joining us and sharing your insights on guarding the pharmacy, compounding's impact on the business of veterinary health. Your expertise in both clinical innovation and business strategy adds such valuable perspective to this important conversation. To all of our listeners, thank you for tuning in and being part of our Veterinary Business Podcast community. We could not do what we do without you. We truly appreciate your continued support and engagement. And if you enjoyed this episode, please share it with your colleagues and friends in the veterinary field. And don't forget to leave us a review on your favorite podcast platform. Also, don't forget to take a look and see Dr. Rae Hutchins' other episode, which was equally fun, but definitely took things along a human-animal bond sort of perspective. The feedback that all of our listeners, as well as our guests, provide allows others in the veterinary community to find us, to give us ideas on deep burning questions that they want us to explore. And our role really is to bring the best information to our listeners. So until next time, keep learning, keep leading, and keep making a difference for the pets and people who depend on you. I wish everyone an amazing week ahead, and thanks again, Dr. Rae Hutchins.